Hello. I guess this upside down is getting old, but I love it. It used to hurt more to do the inversion, and it doesn't hurt as much. I've had this inversion table for a couple years, and when I first got it, it was hurting because, again, the discs were, just getting flatter and flatter. So now I guess I get to puff them up a little bit, and over time, the disc is re-stimulating its ability to be hydrophilic, which means it loves water. The substance in the disc is called glucosaminoglycan. That's what's in the center of the disc, the nucleus part, and it pulls the water in that disc when we sleep at night. And that's why in the morning, I wanted to say, in the morning, that's why when you get up and you go, first time you stand up, that water is like ballooning out, and the disc, is a little worse in the morning. And if it's really bad, I always tell my patients, you pay for in today what you did yesterday. So don't say, oh, I'm bad today. It's what you did yesterday that determined how the disc is swollen in the morning, the following morning. So that's a little trick I've learned. So if you wake up in the morning and you put your feet on the floor and you go, oh, and just sit there and gradually add weight to your spine, and it'll gradually, the water should out of the disc, and the disc should relax and go back, because in the morning it's going to be filled with fluid more so than it was the night before. And that's what happens when, again, we're back to the history of having a childhood trauma. When I fell off the steer and at the camp, and I flew about 20 feet in the air, I got a scar on my left elbow still. I landed on my left cheek, and I went to the nurse at the camp, and she put a little Band-Aid on my elbow, and she didn't know anything about checking the spine and so forth. And then through the years, the spine just kept getting worse and worse and worse, especially when playing tennis. That's something I hope I went over well enough. If you're learning to play tennis, make sure you learn to cross over when you're going for the ball out to the right. Everybody's taught that, right? But I was never taught that. I tried to slow down and keep facing the net and then hit the ball. And that's when you get in trouble, because you put a lot of shear this way on the disc as you're trying to stop. But you want to cross over with the left foot going to the right, and of course the backhand going to the left. That's just a little tennis tip, because every time I play tennis, my back would snap and I would have to stop. That'd be the end of the day. And I didn't know, and nobody ever told me that was because I didn't do proper form crossing over with the tennis. When you're going to the side, you cross over. You don't try to stay facing the net. Oh my, the things I've been through. And then I got worse and worse then I took the motorcycle ride across country sitting on the Yamaha 650, and it just vibrated the disc even more. And next thing you know, I'm thinking about going to chiropractic college. Dr. Walters sees me in Sarasota. I'm tuning the pianos, and so I go to Dr. Walters. He calls the college. I'm right in there. I go there. In the first 2 years, the guy worked on me with activator, which means he didn't do any manipulation or anything. I sort of didn't have any flare-ups. But then he graduated, and as always, when the one guy graduates, he hands over you to the next student doctor. And he was the first time I'd ever had that cracking side posture, called the $1 million roll, or the side posture, which is a good adjustment. If you watch Ed do it, we taught him to get on the ilium, the sacroiliac joint, and to push, up like that to induce the curve. But when they flatten out the curve, when you get somebody who's flattening out the curve, if they don't know what they're doing, you're pulling down, your popping sound, it'll pop going in or going out. It'll make a popping sound either way. And the popping sound has very little to do with it, except I haven't taught you about the way that an adjustment works. It sends a little snap. That little snap sends a signal to the cerebellum and says, stay here, stay here. So when you have either a clicking with the activator, the snap, snap, snap device, or a thrust from a chiropractor, it's basically sending a signal to your cerebellum, which is in the back of your brain. And there's a little picture of you, a little hologram of you in the back of your brain, in the cerebellum. And that hologram is what we're trying to adjust. So the most effective way, if a patient, let's say, has a head over to the right, well, you take and put them with the head over to the left, and then you deliver a thrust, either with the clicking activator or with a thrust of the table. The table has drop pieces in it, and they drop down, and that provides a jolt. And that goes to the hologram in your cerebellum and says, change to here, change to here. So patient comes in like this, you move their head over here, and then deliver a thrust, either with the drop table, an activator, or your hand, and that sends a pulse. And I always envision one day will be like Data on Star Trek. You just plug in somehow to our cerebellums, and we'll go over to the keyboard and we'll type in some new commands for and realign our body. I hate to make chiropractic that simple, but that's the basic to the CBP, chiropractic biophysics technique, is that you're trying to, you look at the patient's posture before you adjust them. So the patient comes in, you look at their posture, and their head's over to the right, their pelvis is over to the left, and you can basically put them in the mirror image, push the head over to the left, and the pelvis over to the left, with the opposite, whatever it is, when they stand there before you, put it in the mirror image, and then deliver a thrust somehow, either with the activator or with the drop table. But there's like the receptor beds, and most of them are at the base of the skull, across the top of the shoulders, and across the top of the iliae. And those are receptor beds where you're going to send the pulse into your system, and you're telling the body, stay here, which means the patient comes in with the head to the right, you put the head to the left, then you either use a pulsing of the thrust of the hands or of the drop table or of anything that you want to use to give a pulse. And that cerebellum will say, okay, I'll stay here. Now it lasts who knows how long, more and more every visit. But that's the ultimate, what the CBP people have come down to be the ultimate. It's not cracking or twisting or rotating. Those only work because in the semblance of putting a patient into the position to be adjusted, it's got the reverse mirror image, we call it, in there. So the head is over to the right, and then you lift the head up and you do the thrust. It's not so much, it is the moving of the bone, but a lot of it is the cracking or the pulse that you put into that little hologram of you in your brain. And one day they're going to figure out how to tap in, or through some kind of pad or whatever, put it on the back of your brain and talk to the cerebellum, and that's going to be how we adjust. But they haven't invented that yet, but maybe somebody out there knows a way to influence the cerebellum, and while they're in the mirror image, and that's how you change somebody's posture, and that's how you fix the spine. You don't fix it by cracking it, or I know we like to hear the cracks, but to change the posture is the ultimate goal. Change the posture. Well, that might be enough for today. Go ahead and ring the bell, and they tell me to, whatever, subscribe or whatever you do to help the channel and the algorithm, so I can do this and hang here more time with you. All right, guys, we'll see you tomorrow or next week, whenever I get to this again. God bless. Take care.